Diabetes mellitus and diabetes insipidus are two distinct conditions that share the common name of diabetes but have very different causes and symptoms. Patients with diabetes mellitus experience high blood sugar levels due to inadequate insulin production or insulin resistance, leading to symptoms such as frequent urination, increased thirst, and unexplained weight loss. In contrast, diabetes insipidus is characterized by diluted urine and excessive urine output, resulting from the body's inability to properly regulate water balance due to deficits in the antidiuretic hormone or kidney response. Effective management for diabetes mellitus often includes a combination of lifestyle changes, medication, and insulin therapy, while treating diabetes insipidus may involve hormone replacement. Risk factors for diabetes mellitus include obesity, lack of exercise, and genetic predisposition, whereas diabetes insipidus can be caused by injury to the hypothalamus or pituitary gland, certain diseases, and hereditary factors. For those looking to understand the nuances between these two conditions, here are the detailed aspects of each disease. Affected organ system, endocrine versus renal. Diabetes mellitus and diabetes insipidus, despite their similar names, are distinct conditions with different pathophysiologies. Diabetes mellitus stems from problems with insulin production in the pancreas, resulting in abnormal carbohydrate metabolism and high blood glucose levels. Classic symptoms include frequent urination, excessive thirst, and hunger. On the other hand, diabetes insipidus relates to renal dysfunction or inappropriate antidiuretic hormone regulation, which leads to diluted urine and consequently dehydration and intense thirst. Endocrinologists play a key role in differentiating between these two through blood glucose tests and water deprivation tests, ensuring that patients receive the correct diagnosis and treatment for these non-interchangeable disorders. Nature of defect, insulin utilization versus water regulation. Diabetes insipidus and diabetes mellitus are two distinct disorders that share the common symptom of excessive urination but have fundamentally different underlying causes. Diabetes mellitus results from defective insulin production or activity, disrupting glucose uptake into cells and leading to high blood sugar levels, which can cause a cascade of metabolic complications. In contrast, diabetes insipidus originates from an inability to regulate water balance due to inadequate secretion or response to the antidiuretic hormone, vasopressin, causing the kidneys to excrete an abnormal amount of dilute urine. While both conditions require careful management, their treatments diverge significantly, focusing on blood sugar control for diabetes mellitus and fluid balance for diabetes insipidus. Symptoms presentation: hyperglycemia versus polyuria, dilute urine. Diabetes insipidus and diabetes mellitus are vastly distinct conditions with a commonality in the symptom of polyuria, or excessive urine output. However, their underlying pathophysiology varies dramatically. Diabetes mellitus is characterized by hyperglycemia, an elevation in blood glucose levels, often leading to the classic triad of symptoms: polyuria, polydipsia, increased thirst, and polyphagia, increased hunger. This is due to insulin deficiency or resistance, impairing glucose uptake into cells. On the other hand, diabetes insipidus arises from a deficiency in the antidiuretic hormone vasopressin or a resistance to its effects, leading to the production of large volumes of dilute urine. It shares polyuria and polydipsia with diabetes mellitus, but lacks hyperglycemia and the associated metabolic disturbances such as ketosis. Distinguishing these conditions is crucial as their management strategies diverge significantly, focusing on blood sugar control in diabetes mellitus and fluid balance and vasopressin regulation in diabetes insipidus. Primary hormonal disturbance, insulin deficiency resistance versus ADH deficiency resistance. Diabetes mellitus, type 1 and type 2, primarily involves disturbances in insulin, a hormone produced by the pancreas which regulates glucose levels in the blood. Type 1 diabetes is characterized by insulin deficiency due to the autoimmune destruction of insulin-producing beta cells. In contrast, type 2 diabetes stems from insulin resistance, where the body's cells fail to respond to insulin effectively. On the other hand, diabetes insipidus represents a completely different pathology, centering on antidiuretic hormone, ADH, deficiency or resistance. ADH, produced by the hypothalamus and released by the pituitary gland, controls water balance and kidney function. In diabetes insipidus, impaired ADH function leads to excessive urination and thirst independent of blood glucose control. Despite shared nomenclature, the two diseases differ fundamentally in hormonal dysregulation, manifestations, and management strategies. Treatment approach: glucose control versus fluid and electrolyte balance. Diabetes mellitus and diabetes insipidus are distinct conditions, both involving frequent urination and thirst, yet differing in causation, pathophysiology, and treatment. In diabetes mellitus, poor glucose control is the focus due to insulin deficiencies or resistance, leading to elevated blood sugar levels. Management includes dietary changes, oral hypoglycemics, or insulin therapy to maintain blood glucose within a normal range. On the other hand, diabetes insipidus stems from vasopressin, antidiuretic hormone deficiencies, or renal insensitivity to it, resulting in excessive dilute urine. Treatment is centered on fluid and electrolyte balance, with vasopressin analogs like desmopressin for central diabetes insipidus, or diuretics and NSAIDs for nephrogenic types to reduce urine output and ensure proper hydration.